So you just found out you're expecting twins, or triplets, or maybe even more. That is a huge, life-changing moment. It's filled with so much excitement and, let's be honest, probably a million questions. Well, we're here to walk you through this incredible journey and hopefully make it all feel a lot more clear and manageable. And this quote, it just gets to the heart of it, doesn't it? It perfectly captures that feeling of double the joy, but also double the things to think about. And that's okay. So let's lean into both.
Okay, so let's dive right in by just making sure we're all on the same page. What are we really talking about when we use a term like high-order multiple pregnancy?
It sounds pretty straightforward, and it is. It's any pregnancy where you're carrying more than one baby. That means twins, whether they're identical or fraternal, triplets, quadruplets, you get the idea. It's a simple definition, but it signals a journey that needs a more specialized game plan.
Now, the reason we need that special approach is that, well, the stakes are a little higher. This isn't meant to cause any alarm at all. It's really just about acknowledging that with more babies, the level of care and attention has to go up right along with them. It's all about being prepared.
And that's the big question, right? It's not just about needing more diapers down the road. The actual biology of the pregnancy and some of the potential risks are just fundamentally different than when you're carrying one baby. So let's break down exactly what that looks like.
This table really lays it out so clearly. If you look at a singleton pregnancy, you have your standard set of risks. But with a multiple pregnancy, there's just a higher chance of things like being born early, preeclampsia, or gestational diabetes. And because of that, you can see how the monitoring has to change. It goes from a routine schedule to something much more frequent and specialized. And all of that leads to the care plan. It's no longer a one-size-fits-all path. It becomes something that's built specifically for you and your babies.
So, knowing all this, when does it become absolutely essential to see a maternal fetal specialist? Well, the good news is the signs are actually really clear. Let's go through them.
The big takeaway here is that if any of these are true for you, then getting a specialist on your team is the way to go. I mean, just carrying multiples is reason number one, but it's also super important if your babies share a placenta, that's called a monochorionic pregnancy, or if one baby seems to be growing at a different rate. And of course, your own health history matters too. At the end of the day, it's all about getting that expert care as early as possible for safe, proactive planning.
Okay, so you've been referred. What happens next? I know it can feel a little intimidating, but the really great news is that this whole journey is designed to be a clear, structured process. There's a roadmap. And this is just so important for your peace of mind. Knowing that there's a predictable path, that this isn't uncharted territory for your care team, can make a world of difference. It's not about reacting to issues as they come up. It's about staying one step ahead. What's so great is how these steps just build on each other. It all kicks off with step 1, a really detailed ultrasound to get the complete layout. How many babies, how many placentas, the whole 9 yards. That information flows right into step 2, where regular scans keep a close eye on each baby's growth. All the while, step 3 is happening. That's keeping a close eye on your health. Then, as you get closer to the big day, the focus turns to step 4, planning the delivery, and finally, step 5, making sure all the right support teams are in the loop ahead of time. See, it's a logical process.
Of course, even with the best plan in the world, you're going to have questions. You probably have a ton of them swirling in your head right now. So let's just tackle some of the most common ones head on. This is usually one of the first things people wonder. With all this talk about monitoring, does that mean you'll be at the doctor's office a lot more? The answer is a big yes, and for a very good reason. Those frequent ultrasounds are your care team's best tool for checking on each baby individually and making sure that placenta is doing its job for everyone. And hey, think of it as getting more sneak peeks.
The timing question. This is another big one. With more than one baby on the way, does that automatically mean they're coming early?
It's true. It is really common for multiples to be born before that 37-week mark. But here's the thing. The whole goal of all that close monitoring is to find the perfect sweet spot, giving your babies as much time as possible to grow and mature, while making sure they're delivered at the absolute safest time for both them and for you.
This is such a personal and important question for so many people. Is a vaginal birth just off the table when you're having multiples?
And the answer is, sometimes, absolutely. It is definitely not an automatic no. It really depends on a few key things, like the positions of the babies, especially that first baby in line, and everyone's overall health. The most important part is that this decision is a partnership between you and your care team, with safety always being the #1 priority.
You might have come across this acronym, TTTS. It can sound a little intimidating if you don't know what it is. It stands for twin-to-twin transfusion syndrome. So let's demystify it.
Okay, so this is a specific condition that can affect some identical twins when they share a placenta. It basically causes an imbalance in the blood flow between them. But, and this is the really important part, your team is actively screening for this at all those frequent scans. It's something they're looking for. And if they do detect it, there are amazing specialized fetal therapies that can help.
This just sums it all up, doesn't it? The very thing that brings all this extra joy, more than one baby, is the very same reason that having that extra expertise and personalized care is so crucial.
Because that's what this is all about, right? It's about turning uncertainty into empowerment. When you understand the path ahead, when you know what to expect and feel supported by your team, you can be ready. You can be ready to navigate this incredible, unique journey with real confidence.